Welcome back to the episode here on the Hard Hustle Podcast. Today's guest, though, the man, the myth, the legend, Steven. Or Steve, not Steven. Why did I give an extra end at the end of it? Steve, good morning, man. How are you?
Good morning. I'm good. Great to be here.
Say, man, listen, always an honor to be here with other great leaders that are just kind of speaking in the space of impact. And I ask you, man, this space wasn't always what you were doing. Can we kind of talk about how you got to this space, to this organization?
Yeah, I don't have a dramatic origin story. My kind of move into operations and behavioral health happened. The moment really happened at 2 a.m. with my newborn, and it's the only time I was seeing him. I was currently working in healthcare, but in investment banking, and recognized that the only time he was awake and I was home was in the middle of the night. And I made him a promise that I was going to be present. And shortly after, I got a call from a headhunter to look at an opportunity in New York where I was living, and private equity backed startup business in the behavioral health space, and gave me the opportunity to stay local, but take a risk. I moved into that role, and it one of the best decisions I ever made. So kind of by chance, but was really fortunate. It fit me really well, and I haven't looked back.
So I ask you, man, you make the decision, you had the conversation with your son. Kudos to you as a father. I think it's really crucial that as men we show up in our kids' lives. So kudos to that. But is this a question that you're having with God? Like, what? I can't imagine you just making a decision on your own. Is it a question? Is it something you're talking to with your wife on this career change? What does it look like when you're in those moments?
Yeah, I had the fortune of being able to take a risk. It was a big change. I don't want to make light of it. I probably cut pay in half, and took a risk on a startup business. And my wife, fortunately, we were at Goldman together, and she was going to continue and allowed me to take that risk. And it wasn't so much. It was about creating a life that I could both have a job that was exhilarating, and be present with my family, but it wasn't so much that it's less work. I think being an entrepreneur is not an easy
Never.
path. So, and it's certainly not less stress. It's actually quite a bit more stress, which drives the work side, but it's more flexible. You can create a life around it. I love it. I do what I do because it's a passion. It gets me up every morning, and not for the wrong reasons, and I can still carve out time and be present.
Was this your first rodeo in entrepreneurship?
Yeah, yeah. So I was finance education, University of Texas, Austin undergrad, MBA finance again, and then investment banking. So I just happened into the healthcare group within investment banking. This opportunity that was presented to me was in an area, behavioral health, but freestanding psychiatric hospitals that I knew well because of the work I was doing at the bank. I had a lot of belief that it was a sector that was important, and just a good, I was going to put basically my whole investment in there, right? I mean, that's
Yeah.
what you're doing when you choose to be an entrepreneur. You're kind of all in, and I was comfortable with that as an investment, as well as how I wanted to spend my time, and it worked really well. It worked well enough that I could then, as a CFO of that business, but then raise money to start Sun, and that you know that experience is, if you can find your way to be an entrepreneur, run a business, I can't imagine anything else.
Yeah.
It's really a blessing.
And how many years have you been doing it now, entrepreneurship?
So that was '07. Sun, I started in 14, 13 technically, but it got funded in 14. So yeah, it's just this business. We're now unbelievably 11 years in. We didn't
Yeah.
start our first hospital though until 16, so a little less in terms of operations.
Hey man, that's still so many years. People fail within the first years, give up within the
Yeah.
first, the second, third year. What I love about this is you kind of mentioned you still have the stress, but Doesn't it feel better that you get to stress about your own problems than actually stressing about somebody else's problems, Steve?
Well, yeah, for sure. I love it. I mean, what I love about it is, the nature of being an entrepreneur is you're solving a puzzle, right? There's some reason that somebody hasn't figured out how to provide this service, whatever you're doing.
Yeah.
And it could be a barber shop, it could be, there aren't enough around, it could be anything, but somebody hasn't filled that gap. You take the risk to fill the gap, and you kind of make the estimates around, is there a need for my service? Can I do it, in a kind of sustainable way? Um, and the rules change. It's not static, and
Yep.
so you have to keep solving that. And to me, it's exhilarating. And then you have to move people. Our team, it's large, and we have to figure out how to move them all in the same direction to achieve whatever strategy we've come up with.
So starting off, you mentioned the first hospital didn't come up to 2014. Was that correct?
I funded in 2014, and then we did de novo hospital, so we started the hospital. So the actual opening of the first hospital wasn't until 16.
16. And is it still just one, or did you actually grow?
So we kept doing that. We opened another one in 17, two more in 18, and
Wow.
yeah, and they're big. For psychiatric hospitals, they're large, and it's expensive. And so we took a pause as for development, to kind of make sure all of those were working well.
Mhm.
And as they all kind of hit profitability, sustainable operations, the COVID hit, and then we kind of one thing after the other from then. But we've rolled with it. Fortunately, we hit profitability exactly before COVID. I mean, it was kind of, the timing was incredible, and that's a moment that could really have taken down the business. It just happened that our operations all started to click just before, I think we hit profitability in 19, and it was like fall of 19. And so by the time COVID came around, we were sustainable. Obviously, census fell immediately, but it rebounded pretty quickly just because of the nature of the business. Hospitals can't close, right? That's an
Yeah.
essential service.
I mean, who would have thought, Steve, you take this risk, all right? And just because you wanted a better life for you, your family, something more that you were able to control. And here you are opening up hospitals, not just one, multiple. Was this part of the vision?
Oh yeah. So what we had done at Ascend is we started the first hospital, as far as I know, and I say we. I was in '05 before I arrived. So they had started the first hospital in 15 years. No hospitals had been open. In fact, they were closing throughout the 90s as managed
Wow.
care kind of changed the business model. So when it opened, it was just like, I mean, the demand was incredible. It just, you make this investment, there's 104 beds, that one, and
Wow.
all of a sudden, within months, you can't keep up. And so they knew they had something. And so when I joined them in '07, they had just that one hospital, but we started four more, and then we purchased four. And in each case, the need was just incredible. But and the investors sold that business in 12, and I had that year-long non-compete, and I started in 13, but with a thesis that there's still more opportunity out there for de novo. I felt like it was less, like we had covered it. Others had started to start hospitals. We were the first, but we weren't then at that point the only. And I thought there were pockets, and then to start hospitals, not with the thesis, but I thought we'd also do some acquisitions and just kind of grow wherever there was a need.
And you mentioned the piece of the puzzle. I'm a big believer, especially in entrepreneurship and life, that we have all the pieces of the puzzle in front of us. It's just how to put them together is really how we look at it. What is that unmet need as you're looking at these puzzle pieces in this space that most people don't even know exists? And how did Sun decide to actually go there and meet those needs?
Yeah, so SUN is an acronym for solving unmet needs, and it's more than just our branding. That's really the filter through which we think about all of our
Mhm.
business decisions. And so we first is trying to figure out where is the need, and the way we define it is as people try to navigate their behavioral health needs, they get stuck. They get stuck, one, because the system's pretty hard to navigate, but also because providers haven't figured out how to provide the services in a sustainable way.
Yeah.
Reimbursement in behavioral health is pretty light, and so there are areas that people haven't figured out the business model. You can't do it. Rural is an example. There are a number of areas, and psychiatric hospitals was one of them. Although I think that's less. I think it's still a need. The dynamics that you need to start a hospital are more than just a need for a few beds. You actually need some scale, or you're not going to be able to reach profitability. So, might be a need for 20 beds, but that need may never get filled because nobody can figure out how to do that profitably. So that's an example, and that continues to serve us. So as we think about entering new services today, they're not hospital at the moment.
Yeah.
We're not thinking as much about new de novo hospitals, but there are plenty of areas within behavioral health that have a need.
And you just mentioned kind of on the hospital space, at some point they were closing. There's the need. Why have psychiatric hospitals been such a taboo or forgotten part of the healthcare system, you think?
Yeah, I mean, it's pricing. The reality is funding in our space, basically funding is the answer. People chase, areas where you have sufficient funding, and you see that happen to the extreme and the bad and the wrong direction. I believe. I think you people chasing, that I call it the kind of the current shiny object, isn't necessarily the right business model. The hospital area, the issue has been the funding only works at a certain parameters. The rate has to be enough, the demand has to be enough, geography, their catchment area has to be accessible. Patients have to be able to get there. Some geographies are very, very difficult to navigate, too much traffic. And so what we have found is we wouldn't build a hospital under 100 beds. We don't have the economy to scale. We don't break even until we get to 70. So to give you a sense, there are roughly 1,500 psychiatric units across the country. These are medical hospitals that have a psychiatric unit. So amongst the many different services they'll have psych. Those units average 30 beds. We'd lose money at 30 beds. We open a hospital, we're still losing money at 30, and so since it's 30, and so you can almost guarantee those are all losing money. And so it's about 1,500 of those, about 500 freestanding psych hospitals. Those average about 100 beds, and at 100 beds, they should be making money. And so that's part of that dynamic is just economies of scale have to be present to make it work.
Hey, real quick, if you're enjoying the podcast, we first want to say thank you. And we also just want to give you a little insight of what we're up to at Francis. Some don't even realize that we're working with organizations to help them use AI to create that real human communication experiences, whether that's actually supporting your families, those patients, or the entire community. We're actually creating tech that connects. Check it out, francis.ai. And do you think right now with what's happening at the government level, we talk about just government funds, you mentioned reimbursements and policy, is that kind of taking an effect to what you guys are doing and how you guys are operating?
Yeah, it's everything. I mean, the healthcare system is from a provider side, a set of incentives. And so they incent us to do one thing or another, and people flock, and that's driving, what our healthcare system looks like. And the way the incentives are set today, they're about to change a lot. We are predominantly Medicaid. We probably, in a hospital, are probably 60% Medicaid, and we also do home and community-based services that are, 99% Medicaid.
Yeah.
And so the I can't call it the one big beautiful bill. So OB3 it will dramatically change that scenario if it's implemented the way that it's currently designed. Politicians being politicians put all the goodies up front, right? The tax breaks are right away, and all the real cruelty happens later. And I think what we're seeing today, the government shutdown around the subsidies for the exchange, this is nothing. This is like a nuisance compared to what's coming. And what will happen, if all of it gets implemented, particularly what begins in 2028, when there's a new administration, politicians are savvy that way. you'd have hospitals failing. You're just taking away so much of the reimbursement. People get upset about the provider tax, and it's a gimmick. Well, it's how Congress set up payment for these hospitals. So
Yep.
without it, it doesn't work. And so you take it away, you're going to have hospitals fail. So yeah, it's always a factor. We feel good about our strategy around that, but it's an active strategy.
I was going to say that. Like, what does that look like, and how does it position yourself for the next 5 to 10 years? Is it just thinking different, working
Yeah.
outside the box, creating your own lane? Is that what it look like, Steve?
Yeah, it for sure it does. So we so specifically about provider tax, we have some provider tax exposure, but by the time it comes around, it won't be what it won't be critical to what we do. Now, I
Yeah.
actually think that will get kicked. I just they aren't going to let all those hospitals shut down. They're going to have to find a smarter way, and I have thoughts on that if they want some ideas. but
There you go.
but we aren't going to hope that legislators change the law. That's the law. We'll model around it. So what we're doing, so we've made a pretty significant move into home and community-based services, and the value to that to the payers is just really pretty extraordinary. They're providing just great outcomes at very low cost. It isn't hospital level, so you're not getting the same. You're not going to cover the same
Yeah.
active, suicidal. Those folks still need to go to a hospital, but when they discharge, if they're getting into the home and community services, then they're very unlikely to move back into a hospital, into that crisis care, which is great. Just so you're lowering utilization, and we can do that. We're doing that in a number of states. So that's one area we'll do it, but we'll diversify away so that we're not come 2028, we're not exposed in a big way. But that's what we've done the whole time. When I started the business, Affordable Care Act was going to create challenges, and we designed our way through that as well.
I ask you, man, is there any, with just kind of the space that we're in, innovation happening in a sense of technology that could also help out? I mean, so many people are kind of looking at the AI and how could we add that and leverage that as a less overhead, but still have the impact of if we're having
Yeah.
5, 10 more employees. Are you guys in that space as well, leveraging
Yeah,
that?
for sure. I'm super excited about it. We're using it pretty heavily in our intake department right now.
Love it.
So our intake, when you get a referral, you might get a 100-page fax, and it could be a mix of pictures and kind of a disorganized. Think about a PDF, but it could have some of it's not very legible, and so our providers kind of have to quickly go through that, make an assessment as to whether we can cover whether we can care for the patient, or not, whether they meet our criteria, and then whether we have the ability to take care of them. And we have AI now look at that referral in seconds, and so it's giving our providers a very good snapshot. We can ask any question we want of it, and so we've arranged the output that way, and it's allowing us to respond quickly to the referral source. So that's a way. There's another what I think would be game changing if we could make it work. There's some patient monitoring that I think using machine learning that I think can really help our staff. That is not in deployment. We've done a little pilot on it, but if we can make that work, that's another just incredible leapfrog. So I think there are some areas, and then there's like ambient scribes, so you can have AI listening and do a first cut at the notes and things like that, that are kind of, even at this point, even more of a commodity, but some of the other areas that can really change the game.
Yeah, no, everything that you're saying is definitely one of those game changers. Some that I've seen implement them, and some that, as you mentioned, are kind of early in the space. But I think when we talk about just the ambient listening, I think there's so much leverage in that, right? It allows people to really do what they love more, Steve,
Exactly.
and really just focus on that patient versus always feeling the need of documentation and
Yeah.
making sure that every I is dotted and every T is crossed because it's how you guys get paid, right? The documentation, that's just kind of one
Yeah.
of the crucial pieces of it. So we can fix that, man. I think more people would even get into the space. We see what happened during pandemic. A lot of people
Yeah.
left the healthcare just because they felt just kind of overwhelmed and exhausted on the work they were doing. Are you are not because I'm not in the healthcare space, but are we seeing an increase on what that actually looks like? People coming back to this space of
Yeah.
healthcare.
Yeah, and I want to just circle back on something you just said, which is it helps our staff, and that is we're not actually seeing any staff reduction. So that's
Good.
I think what people miss is that, AI I
Mhm.
think does cause some fear, but the reality is I think can just make the job it can make you so much more impactful in your job doing the work you want to be doing. So anyway, and then yeah, we do see people coming back. Obviously, 22 was really tough across the country. I think wage inflation was spike in 22 was we couldn't keep up with it. People we just couldn't hire. We couldn't raise our prices. We couldn't raise our the amount we paid enough to get people back. And then at the end of 22, that started to change. In 23, it helped a lot. We'd had increased wages quite a bit, but we finally were getting people back. And then I think, interestingly, even all of these changes with what's happening to Medicaid, we're seeing some additional staff through it might be a government agency that's getting consolidated, and so staff are freeing up for that, and so we're taking advantage of some of that. Some really good people getting let go, and then quite frankly, recessions are always better for our space than most. People with licenses that may not be fully utilizing them, maybe working part time, need to come back and do more work, and so we'll see that increase. And so the challenges in the economy actually can help our ability to staff.
I love that. I love that. Well, when you think about just the space, I want to kind of go back to that financial world. Do you think that sets you up for this space to be this entrepreneur, to be this leader? I'm a big believer that life happens for certain reasons, and it seems like you
Yeah.
just kind of were a shoe-in to the space of growth, and your financial background really helped on that. Do you agree?
I do, and I learned a ton. I think both things. I use it. I still use it every day. I can't not. I think
Hmm.
it really in terms of, I'm in a, I'm in a spreadsheet, a lot, a lot more than maybe is natural for my position. But it helps me think. It helps me, and the numbers help me think through it. I will say the part I learned when I shifted from being a CFO to CEO is culture. So I felt like I could really put a good strategy together, and when I got to the CEO seat, I learned that a strategy by itself is nothing. It's just
Okay.
it's a paperweight. I can't do it. I'm not going to treat any patients. I'm not even licensed to do that. And so if I can't move the organization, then nothing happens. And so that's culture to me. And so we spend a lot of time pushing out, what is the culture we want? What do we? And I think about it is my actions create a ripple down effect that ultimately staff that are interacting with our patients should feel. And so I need to model exactly how I think that should look all the way down to patient family interactions.
I love you bring that up, culture. A lot of organizations are really focusing on what that actually looks like. And for you guys, Steve, what does it look like? What does culture look like? What are some of the things you guys are implementing to? Because I think that's what keeps people coming back. Right, your staff coming back happy, excited to do the work that you're doing, but also for others to kind of spread the word when they go and visit one of these hospitals. Like, man, the experience, the culture, the way they made me feel, all that. I think when we talk about hospitals in general, the experience, right, hasn't been the best. So people don't say,
Yeah.
hey, you should go to this hospital because it wasn't a good experience anyway. But I think if you bring that culture, if you really help the staff start to trickle down to your patients. It does start from, the leadership team as well. What does that look like for you guys, Steve? What are you guys putting into place that could ideally get this going?
Yeah. So my my thoughts on culture is every organization is going to have it, whether you work on it or not. You're going to have a culture, and so we're really intentional about what we want it to be. At this point, we're about 3,000 employees, so
Wow.
yeah, there's a lot. There's a lot of messaging I think that has to get pushed down. It's not easy to reach everyone.
Hmm.
We've been doing for years what we call a values committee, and we do
Okay.
when
Yeah.
I first set our values, I brought together line staff from our hospitals to create the values, and what I told them was values should be the behaviors that we want, that we think are critical. So they were nominated. So these folks were thought to be kind of our best caregivers and actually best culture carriers, because it could have been a receptionist, it could have been dietary, it was obviously nursing, it was therapy, mental health techs, it was people that were had direct patient contact, but it didn't have to be. And so they came up with these behaviors, and so our values are safety, teamwork, integrity, and compassion. And we have been so we set that when we first did that values retreat, and we've done it every year since. We obviously don't change our values each year. We haven't changed them since the original, but we do get together and we talk about what are the things that are limiting our ability to hire, our ability to have kind of the best impact we can have on our patients and their families, and try to implement something new each year. So that's one thing we do. I think, as mentioned earlier, we kind of have to walk the walk. We have let go of some people that are fantastic and technically at their jobs, and they're not great. They don't fit our culture. They're too harsh. They're too they don't train. They don't work in a team. Whatever the reason. And when people, I think, recognize that you mean it, that you don't, people aren't going to stick around if they're not living it. I think that has a positive impact kind of through the organization. They recognize that that's something that really matters to us.
It does too, man. When you think about, especially those that are sitting in high seats, right? If you don't match the values, everyone's seeing it,
Yeah, yeah,
and I've kind of experienced that running a nonprofit, myself, and seeing that I had to pull an event, realizing that we didn't have the effort moving forward, right? Like not everyone was putting their weight in. It was like 2 or 3 out of 10. And at some point as a leader, you have to kind of, wind that back and say, listen, we have a lot of growing to do, at the foundation level.
yeah.
And people can try to scale, but the foundation is broken. You're making sure this foundation is a steady foundation, and then we can build up. And it looks like you guys are doing an amazing job, man. But I ask you, if you could kind of wave a wand and change one regulatory barrier overnight, what would that actually look like?
Yeah, I mean, so the thing that we continue to fight for is let us run a treatment plan that
Mm.
creates the outcomes that quite frankly everybody's expecting, the patient's expecting, the payer's expecting, we're expecting. Um, and so that one would be to change the way that we're incented and allow us to use any tool we think we need, if that's housing, if that's food, whatever we think we need to provide care, and to keep a patient healthy, allow us to do that. I'll say, we do the things that we do today because they work. One, we think that obviously we're solving a need, but we also think it works in the current fee-for-service environment, and so that's what put us there. Do I think, kind of our ending our services with a discharge after 7 days of somebody that came to us, actively suicidal, is the best care? I don't. I think we should continue to hold on to them, but we can't do it financially. It doesn't work. And so if I could change that, I would think about how we take care of patients on a longitudinal basis. Like let's think about them from a perspective of months and years instead of the 5 to 7 days we interact with them. That's the hospital side.
Eh, Let's talk to those that may just have a different perspective on this all, right? What would you say to someone who thinks behavioral health just isn't a business opportunity in general?
Yeah, yeah. I don't know if this is what you mean by the profits over patients. There's a lot of so one, we're hospitals, so that's, we already get some arrows thrown at us for that, and
Mhm.
then because that's expensive care, and then we're for profit, so we get arrows for that. Not me directly, I don't feel it,
Yeah.
but I know as a category. What I offer is, I'm an entrepreneur. I had the opportunity. I saw something. I saw a gap that needed a solution. I thought I had a solution. Um, I raised money, and I raised money from private equity groups because that's who was available. The government wasn't going to give me money. I couldn't run a not-for-profit and raise the kind of money I needed. Donations weren't going to do it for me, and so I had one option. And quite frankly, I have a lot of respect for those guys. I mean, they took a risk on somebody who'd never been a CEO, was asking for tens of millions of dollars, telling them that we were going to be a startup, starting hospitals. We're going to lose a lot of money before we ever saw profitability. Years later, it wasn't going to be
Mhm.
fast, and they said okay. I mean, I really struggle, the number of lives we've saved because our team does the work we do. I mean, it's like it's profound. It
Yeah.
really is. And so what was the solution? The government should have done it. Well, they didn't do it. The not-for-profit should have stepped in. They didn't. And so that to me is just like, I don't care who gave us the money. It didn't really matter to me. I had a vision, and they allowed me to live it. And quite frankly, they don't meddle in what we do. They don't tell me my staffing ratios. They don't, they don't do any of that. And so I have a lot of respect for them, and taking that risk. And I hope it works out for them financially, quite frankly, because other people then will fund, similar, people, that are in my position, and coming to them with a real solution.
And for any other finance or business leader thinking of mission work, you kind of mentioned how you took a pay cut. I can imagine you gained that back in the work of purpose and passion, right? Like ideally, that's really what fills our cup is not so much money. Money comes and goes. What advice would you give to those that are kind of maybe wanting to do the same thing as a CFO in the financial world, but it's risky. It's a pay cut.
Yeah, I mean, look, everybody's got to think about that personally. I'm not going to tell people to take a leap that's dangerous for their family. You need to be
Hmm.
able to support. I was fortunate. My wife worked. She continues to work. She's a superstar. But so I had that. I had that flexibility. I would say you're right. Kind of what we do. That will get you up in the morning. The work you do fills your cup. It is, you're happy to do it every day. That's an incredible place to be if you can get there. Um, Specifically, people coming from finance, I think that really pay attention to the people side. Really pay attention to how are you going to move the organization? Because, like me, you can put it on paper and you might be really good at the math and it might all make a ton of sense. But if you don't know how to move people, you're not going to implement your genius. It's just not going to
Yeah.
happen. And so make sure you really want to dive into both sides.
I love that. Move people. You definitely have to at that role of a CEO. Um, as we start to wrap things up, I really want to kind of go back to because you mentioned this person multiple times, and it was your wife, is your partner. And a lot of times, having that good partner at home is everything. What because when things get tough, when it seems like you should quit, I can imagine your wife was there, was cheering you on, and say, "Honey, you got this." And I say that because as a man, my wife was that for me. And I don't know that ladies and women get the credit enough. Not only are they the mother of our kids and they do that work 24/7 and allow us to go and just do what we do to provide for our home. So shout outs to your wife. I can imagine that's just kind of your number one supporter. Would you say, Steve? Number one supporter is your
100%.
wife?
Yeah, she's yeah, for sure. It's funny because she's doing everything I'm doing, but she also gets all the calls from the kids. It's funny. I don't know how she handles it all. She's
Yeah.
got a really big job and does an incredible job at it, and she's still the one not forgetting about they need whatever picked up from
So how to
wherever.
make sure, Steve, we take that time to just show a little bit of love because I know the work that
For
you've
sure.
done. That,
For
we don't want it to go unnoticed, and a lot of times I don't know we can say thank you enough. So definitely just thank her for allowing you to be in this space, man.
Yeah,
Because we
no
need
doubt.
leaders like you in this space. Clearly, you've done a phenomenal job, and look at just in a very short period of time, to be quite frank. Like you spent a lot more in the financial space, but just in this space, you spent a little bit of time and look at the impacts you've already made. What does it look like for the next 10 years, especially with support systems like that? So I love it, man. What can people find more of the organization or just even more of you? Are you on LinkedIn and what's the website to the organization?
Yeah, we're sunbehavioralhealth.com. Yeah, I'm on LinkedIn, but I don't know, Stephen Page. You're right at the beginning. It is Stephen. I go by Steve, but it's Stephen Page on LinkedIn. I don't know. You do Sun Behavioral Health, that'll be enough. Um,
Yeah.
and yeah, we're out there. We're not that big, but we're growing, and hopefully we'll have
Oh man, you guys are big. What are you talking about, man? I'll leave you with this blind question, man. A blind question that I like to ask every leader at the end of it all. You
yeah.
made a successful transition from banking to behavioral health and built really a growing company. What's that one personal failure or decision you regret, and how's it helped you shaped as a leader today? Because I think people look at you as a CEO and think a lot of success, but that wasn't always the case, right?
Oh my goodness, no, it's not a straight path. Yeah, I mean, I was on the brink of, not making it for
Mhm.
sure. What I did is I probably underestimated the cost to open all those hospitals, and so I really got, behind in terms of my business plan and what I had promised investors, and it almost didn't kind of make it to the other side. It's be as accurate as you can when you're starting up. It's very hard to project that. Do the best you can at setting expectations, and everybody's trying to set expectations that they can beat, but maybe double back and really try to be as conservative as you can be and still raise the money.
Yeah. Entrepreneurship is fun, Steve. I appreciate you taking this time. I love to speak to another entrepreneur. There's so many different things we can take away from entrepreneurship. From patience to failure is okay to like. There's so many things that we can talk
Uh,
about it. So
no
many
doubt.
people want to do this, and I always say it's not for everybody. It is not for the weak. Like you have to be very strong-minded to go and do these things. As you mentioned, there was times where things weren't going your way, and you still had to push forward or you have to pivot and figure out how do I maneuver, how do I overcome these things. So Steve, man, this is not an easy place. You've been successful in it, you're going to continue to be successful in it, and I can't wait to have more conversations on what the growth actually looks like, Steve. So we appreciate it. If you guys are still watching, make sure you guys go ahead and pick up Steve. Make sure you guys check out what the organization is doing. Follow him on LinkedIn. My name's Efrain. This is Steve. We'll catch you on the next one.
Thanks,
Laters.
Efrain. Loved it. Take care.